The word ethics, as defined in the dictionary, means moral principle that governs a person's behavior or conducting of an activity. In the world, people have many different beliefs of what is morally just and what is not. For this reason, there must be an established set of rules and guidelines in place in medicine in order to protect the rights of patients and their families. These guidelines are made in order to give patients and their families a say in the treatment they receive based on what they want or believe. Along with having a say in treatments, medical ethics also outlines topics including the necessity of informing patients on a treatment they are receiving. Medical ethics holds a significant role and is applied in all areas of healthcare. There are several different types of ethics, including bioethics, research ethics, clinical ethics, and public health ethics that all focus on different topics. Development of medical ethics is a result of false and complex situations in healthcare leading to the creation of these guidelines. Two significantly impactful cases influencing this development include the medical case of a young girl named Karen Quinlan and a study known as the Tuskegee study. Both of these cases significantly influence modern guidelines and rights of patients in medicine. These rights include having the right to choose and a say in the treatment you are receiving that will directly impact your life, along with the right to be informed. Yes, doctors are very intelligent and are trying to help, but ultimately the patient or their family have the right to choose how or if they want to continue with the treatment. Another significant aspect of ethics involves honesty between the patient and physician in regards to being informed on treatment and giving consent. The Tuskegee study occurred from 1932 into the 1950s. In this study, a group of African American men with syphilis were studied and refrained from giving treatment, even after the discovery of penicillin. These men were deceived by the healthcare system and told they were receiving treatment. This study was heavily rooted in racism and highlighted significant issues in healthcare. It was a violation of rights and completely unjust. Medical ethics aims to assure terrible situations like this never happen again by protecting the rights of individuals and assuring they are informed and aware of what is being done to them. Both being informed and having a choice not only gives patients control over their own lives, but helps create a more trusting relationship with doctors and the healthcare system. I am not mentioning the past flaws to make you question trust for the medical field, but instead to inform you on the development of these ethical guidelines that have been put in place to protect your rights. Autonomy is the main guideline of medical ethics. Autonomy is the idea that a patient, guardian, or chosen individual has the ultimate say in treatment given to a patient. This significant guideline emerged after a complicated case of Karen Quinlan in 1975. In this case, a young girl entered a coma and was dependent on a respirator and feeding tube to stay alive. After much consideration and discussion with their priest, the parents asked for the respirator to be removed. The hospital initially agreed, but then changed their mind and refused to abide by the parents' choice. This resulted in the case going to court. The doctors believed that removing a respirator was against their sworn oath, while the parents explained that it was their right to privacy over their daughter's life. The parents won the case, leading to the development of autonomy. This gives parents or trusted individuals the right to make challenging decisions regarding the treatment they receive. It allows people to be able to follow what they believe is morally right or simply what the patient would want. It helps establish and create a trusting relationship with healthcare because the patients themselves or the people who know them best are able to make the decisions they seem fit. Overall, medical ethics is intended to protect the rights of patients by giving them control and remain informed regarding the treatments they receive. This helps create a more trusting relationship in healthcare. These guidelines and ethical boards understand that different people have different beliefs and wants during these situations, so establishing a set of guidelines is essential.